एक महीने में प्रेम विवाह किए हैं।
हाँ. Hello guys, good morning and welcome to Example. Good morning everyone. And I hope I'm audible and visible to you. Please confirm me my video and audio both are reaching to you. Okay. So in the today we will discuss the some health issues related to the tribal people of India. Okay, tribal peoples or the tribes in the India are basically the segregated person or the community. So they are facing many issues in which main issue is the health issue, because health issue is the you can say the health issue is the major cause for the other issues or the other problems in any society or any community. Okay, so tribal, what health issues are they are facing, what are how they face the some health issues, and how the government of India and the other institutions are tackling this type of the issue. So in today's session, the discussion point is, or the discussion topic is the health issue in the tribal region or the tribal groups. Okay. So yesterday we also discussed some problems related to the tribal community. What are the social problems, what are the economical problem before this tribal community, what are the environmental problem they are facing at the present time. The basically the tribal communities are the community which does not want to mingle with the developed civilized person. They are used to live in the natural circumstances or their natural environment, and with the strong tradition and the custom. So they does not convert themselves, they does not want to convert themselves easily into the civilized way. But the effort government is efforting, government is doing effort to convert these type of the community into a civilized community, because there is a, if they are living in the in normal condition or the natural way, they are facing many issues. Okay, so tribes is the vulnerable community in the India at the present time, and that is the because of the vulnerability, the government of India is trying to remove that community from the trap of the poverty, trap of the unemployment, and the trap of the health issues. So today's topic discussion, today we will discuss about the health issues. What are the major factor, major cause for the health issues in the tribal areas, and how the government is trying to tackle this problem. Okay, so this is the our topic, the health issues among the tribals. What are the health issues? And this is the question. You can practice this question, you can try to write the answer of this question, because answer writing is a very essential part for the civil services examination. So you should write the answer on the daily basis. If you have the content, if you have the subject matter, then you should try to write the answer. Without subject matter, there is no result, there will be no result, unfruitful effort to write the answer. So please firstly collect the information, collect the knowledge regarding to any topic, and then try to express this knowledge into the uh, through the answer writing. So without knowledge or without understanding of any subject matter or the topic, if you try to write the answer, then it will be unfruitful, there will be no result. Okay, so firstly, don't try to write answer at the very first day. Firstly, you should try to understand the topic, you should make the thinking, you should think about that particular topic, and then after try to write the answer regarding this particular or any particular topic. The many students do the many students decided many students sometimes misguided by some persons, that they started to write the answer at the early stage. But according to me, you should not write the answer at your early stage. You should write the answer when you develop your understanding about any subject matter. Then after you will go to write the answer for the mains perspective. So this is the question. Comment on the recent trend in the tribal healthcare issues while highlighting the causes of the low health profile of the tribal population in the India. Okay, so this is your question for practice. This is your question for practice. You should write the question after the understanding of the issue. So we will discuss the issue, and after then you should write the answer. So write the answer in your notebook, or firstly take a screenshot of this question and you will try to write the answer. What the UPSC has asked, what UPSC has asked related to this topic. UPSC has asked two times related question, two times in the GS in the general studies. The topic related topic is the health issues or the health. So what UPSC has asked? The public health system has limitation in providing universal health coverage. Do you think that private sector could help in the bridging the gap? What other viable alternatives would you suggest? This is question that UPSC has asked in GS paper 2 in 2015. Okay, so participation of the private entities or the participation of the private agencies. So what is the role of the private agencies? Is private agencies beneficial to bridging the gap of the public health issues in the country? So this is the question related to the question General Studies paper 2 2015. So second, despite the consistent experience of the high growth, India still goes with the lowest indication of human development. Examine the issues that make balanced and the inclusive development elusive. Okay, this is the question which is also related to the GS paper 2 in 2000. That question has been asked in 2019. Okay, so such type question UPSC has asked. So this topic might be important in your upcoming examination, and this topic is an important topic. So you should focus on this topic. You should make a notes on this topic, because the tribal issue is a major issue in the India, and one of the major issues of the tribes is the health issue. So today we will completely focus on the health issue of the tribes. Okay. So this is the UPSC previous year question. The some points we discussed in the previous session. So what is the major health issue at the present time in the in tribal groups? Okay, what is the major health issue? So firstly, you should understand what is the tribes and what is the status of the tribe in the India. So in the India, India accounts approximate 8.6% of the tribal population of the India's total population. So India's total population is approximate 121 crore. Okay, at the present time, and among the 121 crore, 8.6% peoples belongs from the tribal group, and they are the vulnerable group. Tribal groups, most of the tribal people are in the vulnerable category, because they are completely dependent on the primary sources or the primary sector. Okay, so they are mostly dependent on the natural things or the nature. That is why they are categorized as the vulnerable group, because they don't have the economic development, they don't have the social development, because they are socially and economically backward. Okay, so this is the condition, and the most of tribal people of India is residing either into the Himalayan region or the hilly region or in the forest area. So most of the tribal people are residing in forest region or hilly region. So the states, basically the central state of the India, approximate 9 state. Okay, 9 state consist the mostly tribal population of the India, and the northeastern part of India also consists the tribal people in India. Okay, so you should understand that this is the status. 8.6% population belongs from this community, and the most of this community is residing in this isolated hilly and the forest area. Okay, this is the isolated or the isolated hilly and the forest region. So basically they are living in the isolation. They are not mingled up with the other people which are living in the country. So basically they are living in the isolation. Fertility rate. The fertility rate in the tribal people is basically high. Total fertility rate of the scheduled tribe is 3.2%, which is well above the replacement rate. However, the few expectations are seen in the form of the negative population growth rate, which has been seen in the particularly vulnerable tribal groups inhabiting in the Andaman and Nicobar. The total fertility rate is relatively high than the other areas. Okay, so the fertility rate in this tribal community is relatively high. If the fertility rate is high and the health issues or the health facilities are not in the proper way, then the mortality rate will be high. If the mortality rate will be high, this is indication of the adverse situation or the adverse economic and the social condition. So this is the problem. There is a high fertility rate which is not healthy for the human being, which is not healthy for the person. So high fertility rate is a problem in the tribal areas. In the tribal areas, the people are not nourished in the proper way. They don't have the balanced food. They are completely dependent on the you can say the primary resources or the primary sources, or they are completely dependent on the primary sector. So they are not secure. They don't have the food security. They don't have the balanced nutrition. So because of the unbalanced nutrition and the other issues, the life expectancy rate is relatively low than the other areas in the nation. So in the other part of the country, you can say the life expectancy rate is 67 years. But in the tribal peoples, in the tribal groups, the life expectancy rate is at the present time is 63.9%. 63.9 years. So life expectancy is relatively lower than the other areas. Okay, so life expectancy is low at the present time, 63.9%, and the other areas people has 67 year. So this is 63.9 years in tribal peoples, and in general it is the 67 year. So tribal peoples has less life expectancy than other regions people. Okay, so what are the reasons for the lesser life expectancy? There is a many disease. They are trapped with the many genetic disease. They are trapped with the many genetic disease. They are infected by the other disease. So many disease has impact hypertension and the other issues are related to this tribal community, and because of this type of the issues, the tribal people's life expectancy is relatively less, or the less in this region. Okay, so tribal people has the less life expectancy because of the different type of the disease. Okay, so guys, Exampur is a platform which provides so many services related to many things related to the civil services examination and the other one-day examination and other examination that is conducted in the nation. So Exampur has an official application, and on that particular application you will get the many courses in the free of cost and many courses in the very nominal fee. Okay, so Exampur application or the Exampur official application will provide you will help you in your preparation. Okay, so please download this application and you will get the many things in on this platform. You will get many video lectures, PDFs and the other things which will help you in your preparation, okay, to achieve your target. So firstly, you should download this application to get the benefit on this platform. So first step of this, to go to your Play Store, okay, search there Exampur Sarkari Naukri Prep. The official name of this Exampur application is the Sarkari Exampur Sarkari Naukri Prep, and download this application and register yourself. Okay, register yourself with your mail ID and the mobile number, and you will get the many benefits from this platform. And this application is very useful for the student. This platform is the student friendly platform or the student friendly application. Okay, so download this application and you will get benefited by the many essential things which are required for your examination. Okay, so this is your Exampur application. So please download this application. The tribal people, now the tribal people has many problem in which they are also infected, they are also defected, they are also impacted by the modern disease, because the interaction between the people and the tribal community has been increased in the last several years. So that is because of that interaction or the increase in the interaction, the modern disease also reaches to this region. So today, at the present time, the modern disease has also impact on the tribal people. So you can understand the modern disease due to the land alienation, displacement, prevalence of the poverty, and the resultant indebtedness, tribal women are forced into the prostitution. So there are many problems. There is a indebtedness, tribal problem, resultant indebtedness, displacement, okay, land alienation, and the rehabilitation. These are the some factors. Because of this factor, sometime the tribal women forced to go into the prostitution. Okay, if this type of the activity, if this type of the occupation was adopted by this community, then this occupation has the risk to many sexual transmitted disease. Okay, if there are sexual transmitted disease will introduce in this region, and that disease will very dangerous disease, and that disease will result as a dangerous or the disaster for that particular tribal community. Okay, so such type of the modern disease also has impact on the tribal community. This has led to the increasing caseload of the sexually transmitted disease, including AIDS. Non-communicable disease like the hypertension has also impact on the tribal people. If you are thinking, if you don't have employment, if you don't have employment, then you will think about your livelihoods. If you think about your livelihood, then this type of the disease like the hypertension, the disease like hypertension will impact you. So most of the youth that belongs from the tribal community, they are facing the hypertension problem at present time. Okay, so hypertension is a modern disease. You can say the hypertension is a modern disease, and they are facing this disease. This disease covering the tribal areas because of the overthinking. If you overthink about the negatively overthink regarding anything, then you will suffer such type of disease like the hypertension. As per expert, the cases of the hypertension have increased significantly with the increasing consumption of the tobacco and the alcohol, okay, and prevalence of sedentary lifestyle among the tribal people. If you consume any type of the alcohol and the other any addiction, if you consume addictive things, then it will impact your blood circulation, it will impact your the pace of the blood circulation, and that will cause for your hypertension problem. So in tribal people, recently tobacco consumption and the alcohol consumption is significantly increased, and because of this type of the increment in the addictive things, you can say this is related to the hypertension like problem. In general condition, you know about this hypertension as the blood pressure. Okay, blood pressure. So they are facing the blood pressure or the hypertension problem at the present time. Drug addiction and the mental illness is a major issue in tribal region. Okay, drug addiction and the mental illness. Globally, tribals are known to be easy prey to addictive substance like drugs. Okay, they are easy prey. Easy prey means, what is the mean of the easy prey? That means if you want to deliver anything, the person who are easily convinced, the person who is easily convinced by your ideas, that means that you can sell anything to that particular person. So if you start any drugs, if you want to drugs supply of the drug, want to uh, deliver this drugs at any particular region, the best or the easiest target is the tribal areas. Okay, if you go at the tribal region and you want to supply your drugs at that particular region, they easily can consume, they can easily purchase that particular regions. That is why they are considered as the easiest prey for the drugs. Okay, so this is a major issue in this region. Further, increasing instance of the land alienation and the displacement among the tribal people have exposed them to several existential threats and the resultant mental stress. Okay, land alienation, if you are living in in any particular region and the government is started, or any institution has come at this particular region and is tell to you that I am purchasing your land and you should displace from this region to another region. So this type of this threat to the displacement, threat to the rehabilitation, threat to lose their land, this type of the problem started in the tribal region, and this is called cause for mental stress for the tribal people. This is cause for mental stress in tribal people. Okay, what is a communicable disease? Communicable disease. They also suffered from the communicable disease. As stated above, the tribal communities constitute only about 8.6% of the national population. However, they account above the 30% of the all cases of the malaria and almost 50% of the mortality associated with the malaria. Okay, the tribal population is only 8.6%, but the malaria cases, they are infected by malaria broadly, or you can say badly. 50% of the mortality which is related to the malaria are related to tribal region. So 50%, if the 100 deaths occur in 1 year related to the malaria, so 50 deaths are related or belongs from the tribal region. So 50% mortality related to the malaria belongs from the tribal region. So this is a major concern, because they are living in open atmosphere, they are living in the open environment, so they don't have the precautionary action, they don't taking the precautionary action for protect themselves from such type communicable disease. If the one disease started, or the disease introduced in the one community, then this disease easily can spread in entire community, and after some time the disease will cover the entire community of any particular region. So communicable disease is very dangerous for the tribal people, because they don't have the precautions, they don't have the some precautionary measures, appropriate precautionary measure, they don't have the appropriate precautionary measure. Similarly, the cases of the pulmonary tuberculosis in the tribal communities is significantly higher than the rest of the country. 703 in tribal population as compared to 256 per 1 lakh in rest of the India. Okay, so people who are suffered from the pulmonary tuberculosis or the TB, they are the ratio of, in the normal condition, among the 1 lakh people, 256 people are suffered from this type of the pulmonary tuberculosis. But in the case of the tribal areas, the number or the figure is 703, more than the 2 times. More than the 2 times. It is, I think, 2.5 times, more than 2.5 times. Okay, so people who are infected by the pulmonary tuberculosis is 256. The figure is 256 among 1 lakh people in normal condition. But in tribal areas, this figure will increase, this figure will tall. Okay, so the figure is 756 or approximate 703 in 1 lakh people. That means among the 1 lakh people, 703 people are suffered from the pulmonary tuberculosis, or tuberculosis, you can say the TB. Okay. So this figure also represent the difference between the normal condition and tribal areas. Okay. Nutritional disease. They are not able to take the balanced diet. Sometimes they are only depend upon something which are producing at that particular region in which they are residing. If you are tribal people, you don't have the connection from outside, so you have to depend on the resources that is found on that particular region, because you don't have connectivity from outside. Okay, if you are isolated, if you are not connected to other regions, then you have to dependent on the resources that are producing at that particular region. And it is not necessary that means all type of the nutritions are providing by that products which are producing in that particular region. Okay, so sometime there is a nutritional lackness is seen in the tribal community, because their connection from outside is not well in or proper way, and that is why this will be a big problem. As per the 5th National Family Health Survey conducted during the 2019 to 2021, there is a high prevalence of the cases of malnutrition, including the stunting, underweight, and the wasting among the tribal children. Okay, so malnutrition is a major problem of the entire India. Okay, malnutrition is a major problem of the whole India, but this problem is in worst condition in tribal region. So this problem is in worst condition in the tribal region. So we should focus to remove, or that we should focus to eradicate the malnutrition from entire country, or from a whole nation. But we should focus more, we should emphasize in this region more than the other area, because this region is more affected, or more affected by the malnutrition than other areas. So stunting, underweight, and the wasting is the major problem in the tribal children. In fact, only 30% of the children and the 25% of the pregnant and lactating women consumed as the adequate diet in terms of the protein, energy, calories as per the National Nutrition Monitoring Bureau under the National Institution of the Nutrition. There is a criteria that has been fixed by this institution for the which amount of the calorie is required, which amount of the protein is required for the lactating women or the pregnant women, which amount of the calorie, which amount of the protein, which amount of the other nutrients are required for the children's. That criteria has been declared. On that particular criteria, on the basis of that particular criteria, only 25% of the pregnant and lactating women and the only 30% of the children are getting this type of the nutrition. So you can think about that. 75% of the women which are either pregnant or lactating women, they are not getting proper food, they are not getting proper nutrition. If they are not getting the proper nutrition, then the disease related to the nutrition will arise in this particular region, or that in this particular community. So such type disease will harmful, such type disease is very harmful for their lives. The children, they are the future of this community, they are the future of any community. If they are not completely nourished, they are not has the proper balance or the nutrition, then how you can imagine their youthness when they become the young, how they will productive for any country, or how they are productive for any community. So this is a problem. The malnutrition is a problem, and because of the malnutrition, because of the less nutrition or the nutrition, they are facing the nutritious disease. Okay, so nutritious disease also has impact on this community. Nutritious disease. What is the causes? We discussed what are the problems. Okay, that are the problems. What problem? That are the problems what they are facing. But what is the cause? What are the cause? Why these problems are they are facing? The tribal communities are facing. What are the causes? So, cause for the low health profile. What is the cause? The first is the geographical isolation. The tribal areas are located in the remote geographical areas. Difficult natural condition arising due to the difficult geographical terrain and the large distance from mainstream areas lead to the accidents, snake and the animal bites, and the violence in conflict situation. The geographical isolation also leads to low level of the socio-economic determinants covering aspects like the education, income, housing, connectivity, water, sanitization, poor quality and the inappropriate healthcare services. So first problem, first cause of their geographical isolation. If you are geographically isolated from the main community, then the all infrastructural things are not present at that particular region. If the infrastructural development is not happen in this particular region, then such type problems will arise, and these type problems are these type problems created the chaos in this region or created the problem in this particular community or regions. Okay, so this is the problem. If you are not connected, then such type animal bites, snake bite are cause for the death of the people, and sometimes they belongs to they started to do any type of the rituals for such type in the case of the snake biting, animal biting, and that will that is cause for their death. Okay, if the snake biting is happen, is the snake is biting to any person, so firstly there is a requirement of the anti venom, not any type of the mantras, not any type of the any ritual. So there is a no requirement of the ritual, there is a requirement of the venom, requirement of the anti venom, because the venom, the venomous snake, if the venomous snake or the venomous animal has bited to any person, then there is a requirement to save their life is anti venom, not any type of the ritual. Okay, so such type of the things also has a major problem in the health issues. The next one is the inaccessibility of health services. Inaccessibility of the health issues, health facilities. If you are living in the remote areas, there is a infrastructural lackness, there is a no infrastructure related to the health problems. Okay, so how can you imagine that you will get the accessibility? So there is a accessibility. If you have the fever, if the person living in the Andaman Nicobar in belongs from Jarva community and they have the fever, they should go for 10 kilometer or 12 kilometer for their treatment. So if any person has any disease problem, any person has any person is suffering from any disease, then how if they don't have the accessibility, then that particular disease will impact that person badly. So inaccessibility of health services is also is a major problem in the health issue. So remoteness of the inhabitation and the dispersed population also makes the difficult for the health services to reach the in the time. This is one of the prime cause for the uneven access to healthcare services for the tribals. And there is also a problem, that is a uneven access to the healthcare. There is a uneven access to the healthcare. Okay, unavailability of the food items. There is a unavailability of the food items. Long-term changes can be seen. The agricultural practices of the tribals. For example, due to the changing climate and the market trends, the tribal prefer hybrid varieties of the rice and the pulses to the nutritional native foods. Similarly, the consumption of the meat has declined in the tribal population, leading to the deficiency of the adequate proteins in the diet. Okay, so there is a unavailability of the food items. Okay, traditionally what they are consuming, that things was nutritious for them. They traditionally, the most of the tribal people or the mostly tribals belong was eating the meat, was consuming the meat, but the trend in the consumption of the meat is decreasing at the present time, and that is because of the less consumption of the meat, they are suffering the deficiency of the protein. they are suffering from the deficiency of the protein, and this is a major problem. Disruption of the traditional farming. There is a problem in there is a disruption in the traditional farming. Due to the forest regulation and the ban on shifting agriculture, the tribals dependent on the PDS, public distribution system, and the market system for their food. Okay, mostly the agricultural practice that was done by tribal group was slash and burn agriculture, or you can say jhum agriculture. So shifting agriculture is a problem for you can say environmental perspective, because they slash the forest and burn the forest and practice the agriculture at that particular region. When the fertility will reduce at particular region, they will shift to another area. Such type practice or the such type activity are very harmful for the environment perspective or the forest perspective, and that is why the government has banned this type of the practice, and government started to provide the food through the PDS or the public distribution system. But this type of the food has major issue. PDS has another issue or the related issues that you will study in governance and the economic section. The PDS system in India has many loopholes. Okay, PDS system of India has many loopholes, and because of that loopholes, they are not properly get the supply of the foods, and that is why they are also suffering from health issues. Similarly, they have adopted the modern farming practices, which includes the use of the pesticides, and the fertilizers. They are using the modern technology of the agriculture, modern techniques of the agriculture, and in which modern techniques in modern techniques technique of agriculture, they are using the fertilizer and the pesticide, and this pesticide and the fertilizer has also bad impact or the negative impact on environment as well as their health. Okay, so this is also problem. Therefore, the dietary preference have changed due to the contact with the non-tribals, and they have changed their dietary preference, and if the dietary preference will change, their you can say their nutritious value will change, nutritious things will be changed. Lack of the physical activity. The tribal population have adopted some of the ways of non-tribal people. It includes buying grains and the groceries of the daily use from the market instead of preparing them at home. This had led to lack of physical activity among the tribals, affecting their fitness level. In traditional way, if you go back, I think 30 to 40 years ago, 50 years ago, the people prepare their food at their home. Okay, so if the people want flour, they convert the wheat into the flour at the home. If they require the rice, they convert the paddy into the rice at their home. Because of such type activity, they are physically active. They were physically active, but at present time, the most of this type of activities is done by the machines, and in non-tribal people, this activities is done by the machine, and this type of practices also introduced in the tribal people. They also get the things from market. They also started to purchase the ready materials, and because of that type of the purchasing, they are not able to do any physical work, and because of the absence of the physical work, they are physically unfit. Their fitness level is not so good as they have in the previous years. Okay, so this is a problem. Lack of the physical activity. Prevalence of the poverty is a major problem. Prevalence of the poverty. It is well documented that the tribal groups constitute one of the poorest social groups in the country. This makes many of them dependent on the public distribution system for food grain. The issue with this dependency is that disrupts the tradition food preference of the tribal in favor of the wheat and rice, leading to health related deficiencies. Okay, so poverty, prevalence of the poverty is also a problem of the tribal communities, and it is considered as that they are poorest social group of the nation. The tribal people are the poorest social group of the nation. Okay, so this is a problem. Endogamy and the inbreeding is also a major problem in the tribal people. What is the endogamy? Endogamy means about the gotra. Gotra means same clan. Okay, if the person is married, person are marrying to a lady, or if anyone is married, if a person A and the person B, if A is if A marry with B and both are belongs from the same clan, that means they have the same genetic material. They have same genetic material. If there is a same genetic material, then when the same genetic material, and if any person have disease, if one person has disease or the genetic material is the same, the disease is the same. With the same disease, if the person has any person married with a person which belongs from the same clan, then there is a chances to disease disease will be forwarded in the next generation, or disease will be carried into the next generation. So there is a problem in the tribal region. There is a practice of the endogamy. Endogamy means the marriage of this marriage within the same clan. Okay, so marriage in this within the same clan is a problem. Inbreeding is also a problem in this population. Tribal population are majorly confined to the small geographical region. Since they have been living for the generation in the closest knit community, there are high prevalence of the inbreeding and the endogamy. This leads to the large number of the genetic disorders like the sickle cell anemia in the tribal people. Okay, so this is a problem. Endogamy and inbreeding is also a major problem in tribal community. Okay, if the genetic material has the diversity, if the genetic material are diverse, then there is a less chance to genetic disorders. If the genetic material is the same, and if any genetic disorder is found in this genetic material, then this genetic material will carry forward in the next generation to next generation. There is a less chance to remove that particular genetic disease. Okay, so this is a problem of the tribal people, endogamy and the inbreeding. Belief in the supernatural powers for treatment. Okay, they have the belief in the supernatural powers. If you go Chhattisgarh, Jharkhand region, then they treated some. They believe that some supernatural power is happening, is in existence, and because of that supernatural power, they started to try to treat any disease. Okay, so this is the unscientific way. This is completely unscientific way. No any supernatural power is required to treatment of any disease. There is a requirement of the medicine or the surgery for the treatment of any disease. The tribals have their own system of the beliefs. They distrust outsider and they dependent on the traditional system for health treatment. At the same time, professionals from outsides are unwilling to serve in tribal areas, leading to a shortage of the non-power and the healthcare professional in the tribal areas. Okay, so belief in the supernatural power for treatment in the disease is a very unscientific way, and the people of the tribal community belongs, they have belief on this type of the system, and because of this system, the person which has the professional degree, they never want to treat and this in this region. If any doctor who have the degree, who has the degree of the masters, MD or MS, and if that particular doctor will go at region of the tribal community, and if they are if the person or the doctor is suggesting the people of that particular region or give the prescription related to any disease, and they deny to accept or they deny to follow that prescription, then why this particular professional will be go at that particular region? नहीं, वो नहीं जाएगा, कभी नहीं जाएगा, ठीक है। तो ये आपको ध्यान रखना है कि अगर कोई भी आदमी जाता है तो क्यों जाएगा वो, ठीक है। अगर मैं आपको कोई बात बताऊं, आप नहीं मानो, तो मैं क्यों बताऊंगा? नहीं बताऊंगा, ठीक है। तो कोई प्रोफेशनल होगा तो वो क्यों जाएगा? और ये लोग सुपर नेचुरल बिलीफ्स में बिलोंग, मतलब भरोसा करते हैं। कई बार इनका ये होता है कि कोई भी बीमारी है, कोई भी, किसी को सांप काट लिया, तो ये लोग दवा देने के बजाय क्या होता है, हॉस्पिटल लेने के बजाय उसको झाड़ फूक या इस टाइप से चीज़ें स्टार्ट कर देते हैं। तो ये सारी चीज़ें जो है प्रॉब्लम होती हैं, ये भी इनके प्रॉब्लम है। लैक ऑफ द फाइनेंशियल रिसोर्स, फाइनेंशियल रिसोर्स इज ऑल्सो मेजर कॉज। According to the experts, there is a lack of the adequate allocation of the financial resources for the travel health needs in the most of the state. It is the further complicated by the lack of the transparent accounting of the actual expenditure and the lack of the availability of the data monitoring and the evaluation of the government scheme. Okay, so there is a problem. There is a financial resources, lack of the financial resources. They don't have the more finance. They don't have the financial advancement, or you can say they are financial backward. So there is a problem. But sometime the government started to scheme to help the tribal people, but there is also loopholes. There will be corruption. There should be a corruption. There is a corruption in the government scheme. So it is also problem. Lack of the financial resource is major issue for the health issue. So what should be the way forward for tackling such type problem? Improvement in the indicators. As per the researchers of the Harvard University, the indicator of the life expectancy for tribal in India have shown an improvement over the time. For example, expectancy of the ST women as a birth was 57 years in 1997-2000, which rose to 68 years in 2013-16. During the same period, the life expectancy for the ST males increased from 54 to 62. So, way forward, that means improvement in the indicator. At the present time, improvement is seen in the tribal community, and we should continue this type of improvement in the tribal community. Gains in the child health. Indicators of the child health have shown the marginal improvement from 58% in 1998 to 56% for stunting, 23 to 22% for wasting, and 57 to 52% in case of the underweight. So this marginal improvement has seen in this case, and we should increase this type of the indicator. Access to the modern healthcare. Access to the modern healthcare. The access in the tribal communities, the access of the modern healthcare in the tribal communities has been increased. Okay, there is a need for further expansion of the modern healthcare system in tribal areas. This includes the mobile clinics, telemedicine facilities for the remote tribal areas. At the same time, preventive approaches like the immunization and the regular health camps should be conducted in such area for better access of the health services, health profile. Okay, so such type activities should be conducted in this region, preventive and as well as the curative. Focus to capacity building. Okay, start to focus on the capacity building. There is a need to train the healthcare functionaries so that they consider social and the cultural background of the tribes and act accordingly in the times of the need. Building trust with the tribal will go a long way in the securing their cooperation on multiple areas, including the healthcare. Similarly, local men providing healthcare facilities to tribes like the Vaidyas need to be trained in the advanced diagnostics techniques in the modern medicine. So the government should take such type decision for advancement of this tribal areas. Collective approach. We should follow the collective approach. Okay, we should follow the collective approach due to their wide experience. Non-government organization NGOs have established a relationship based on trust with the tribal. Okay, the government needs to capitalize on this relationship, and NGOs, government organization and the tribal leaders need to work in the coherence in order to improve the status of the tribal people. Okay, so this is the way forward for tribal health issues. And for if you are preparing for the UPSC examination, if you are preparing for the services examination, as well as the other examination, okay, for one day examination, if you are preparing for a one day examination, or your any kin is related to the one day examination, then please suggest to them or download this application, because this exampur application has the special feature, some unique feature, and this application will provide you something extra, what you want, what you require for your examination, what you require during your preparation. And so please download this application. This application is very useful. That application very is beneficial for you. So download this exampur application and get the PDFs from that application, and some free classes that are on the application that will helpful you. That classes are very helpful for your examination. So firstly, you should go in your Play Store, search the Exampur Sarkari Naukri Prep, the name of the official name of this application, and download this application and register yourself with your mobile and email. Okay, so this application is very useful for you. So you should download this application and get benefited from all the things which are available in this application. Okay, so I hope you enjoyed this session, you understand the things, and we will meet into next session. And please subscribe this channel and like this video and share this video. Okay, so we will meet in the next session. Thank you so much.